eat dinner or something, I'd say, what's Lodi up to again? This guy. Well, maybe he'll know when to come on, but whatever. And that's Facebook too. That's the bummer. Yeah. Nobody on Facebook knows that we're back. Are we back? Anyway, so we don't know instinct. We do things out of culture that we were taught. We're enculturated. All right. So based upon our whatever our culture is what we eat, and we usually, not usually, but um, we have to understand that our cuisine is probably the most. I mean, other than language, and I mean, other than language, I'd have to say cuisine is right there with what we are, because it's what we eat, and it's what we were eating before we were six. And what you're eating before you're six has so much emotional um, um, connections, so many emotional connections, because it was your mother feeding you, or your father feeding you, or your grandma feeding you, and it was Thanksgivings and things like that. So, anybody there? Never miss a comment. What are you talking about? Can't post messages to some channels. All right, whatever. I see people on there. I can't see the chats, whatever. So I'm sorry I can't see Facebook your chats, because this is such a fantastic bit of technology. I'm just blown away. Oh, there you are. Cool. Oh my God. Anyway, so back to Diamato. Back to this question just came up. So anyway, as I said, animals eat out of instinct, and you can't get a horse to eat dog food, and you can't get a dog to eat horse food. You just can't do it. They'll die first. Okay, so they eat out of instinct. I mean, instinctually, a bird's going to eat an insect, right? It's not a decision. They don't pendle and see if they should eat it. They just eat it. Well, as it turns out, great, Tony. That's very cool. As it turns out, oh, great, from YouTube too. As it turns out, horses, I think have 11 blood groups, and I think dogs have 6 or 7. Anyway, all creatures have, all like mammals have different blood groups, and it does not affect. It has nothing to do with their diet. All right. I mean, all horses, all 11 or 13 blood groups, like to eat grass and alfalfa. Okay. Remember, they're eating out of instinct, so it's not like they made a choice. Eat right for your blood type. So it's an absurdity to think that some horses should only eat arugula, and I don't know. You understand the absurdity of it? So Diamato comes along with this thing, and he comes up, and all that these kinds of theories are, that are not based on any fact, but they're based on some presumption and assumption. All it does is confuse people more, right? And he has some good, he has whatever, he has some his logic, but it's not true. What humans need to eat is what humans need to eat. And how is that determined? Well, since we've lost our instinct, we don't know, because we've become enculturated, hybrid mutants, and we eat. So, by the way, and the cuisine of a culture is so much associated with the culture that when we think of Italy, I mean, you think of Italy, how beautiful, Florence is, and Venice and all that. But at one point in time, your mind's going to land on pasta and pizza or whatever it is that you like that's Italian. We associate that with the cuisine. And the cuisine is, that's why we see that, well, Italians get diabetes and Italians get strokes and they get heart attacks and stuff like that. And, but if you're not eating sausage, meatballs, brajol, pasta, pizza, you're not going to get that. So anyway, I don't. The Diamato thing is not true. All humans need what humans need. And now, if you want, we will get into that on another, actually on a webinar. I'm going to redo the food thing because I don't think enough people got it. But basically, our body was designed, our GI tract was designed to eat plants. Whatever you want to think about it, I know some of you get angry and you say, well, all right, look, I've been doing this for 5 I've been eating, I'm a carnivore. Well, right there, we know that the unfortunate person has never really thought about it because carnivores eat animals alive, and I don't usually see that. But a lot of humans are eating the corpses, and they're corpse eaters, and so they're actually okay with it. But they don't call it a corpse. Somehow they feel more macho if they say I'm a carnivore. You're not a carnivore. You're a corpse eater, which is like a scavenger, dogs, hyenas. So, okay, yeah, can we get away with eating like that? Yes. Can we get away with smoking cigarettes? Yes. Can we get away with heroin? Yes. Can we get away with drinking every day? Yes. Will we achieve optimal functioning? No. Okay. Now, our intestines, if you took a look at our intestines, they're 10 meters or 30 feet long. And you don't see that kind of intestine in dogs, cats, and any other animal that's designed to eat animals. They have very short and straight GI tracts because guess what happens to the flesh? It begins to putrefy very quickly and is no longer nutritious to the animal who's ingesting it. All right? But it is so antithetical to our very instincts and nature that we never eat animals alive. We never eat raw corpses. We add heat to it. We add spices, and we cut whatever, broil it, onions with garlic, whatever it is we do. We add flavor to it because we're not really into the corpse, and then we change the name. It's a pork chop. It's a nugget. It's beef. So, I've personally never seen a beef walking anywhere. I've never seen a pork chop. It's all nonsense. So we changed the name and we changed it. We heat it up and all that. So, and I know one type of blood is supposed to eat that. The other type is supposed to eat it. That's it's just complete nonsense. Thanks for asking that question. I hope I have time to really show you the science. So, anyway, this channel has become one of my favorite. Oh, thank you. So let's get back to my little thing I wanted to say before we get started. So what I'm trying to tell you is that if don't use their words, don't say that you have stage anything of anything. Because remember, the words they're using to give you the depth, to give you that zodiac sign word, to say that you have chronically fermenting cells, the way they do it is you have to get a biopsy. And when you get a biopsy, the pathologist looks in a microscope and he looks at the microscopic anatomy and he describes it. And his description of the microscopic anatomy becomes what they call a diagnosis. And based on that diagnosis, all right, whatever. I'm age restricted, right? You got to be 18 to listen to me on TikTok. So if you're under 18, just go to one of the other ones. It's so ridiculous. What do I talk about that's age restricted? Uh, so okay, so they look at this. They get, and you have ductal carcinoma in situ. You've got uh, um, what is that? Somebody came in the other day with focal glomerular sclerosis. Sounds smart, right? Sounds like the guy's really smart. You know what that means? Focal means just local, just right, one spot, or in certain spots. Glomerular sclerosis. Well, the glomerula are the little, what do you call it? The parenchyma of kidneys. It's the place where the work is done. These little things called glomeruli. And sclerosis means scarred. So they're saying in certain areas in the kidney, there are places that are scarred at the location of the glomerula, not the tubes. And you say, oh, okay. Um, and they'll go, well, that's it. That's your diagnosis. So you understand that you have no information. He knows no information. They don't know what they're talking about. Now that they have that information, that word, they can stick it into their sales algorithm, and they can say things like, I mean, the sales algorithm will tell them exactly which products and services that this person needs. And they've got it worked out really well. So if this person happens to get a high potassium, then you do this, this, and this. So um, the word diagnosis is a description of the microscopic anatomy of what they think is causing the problem. And then that fits into an algorithm that sells you poisons and procedures, which has nothing to do with restoring health. Do you understand that? You have to understand that completely. Because whatever they told you, that those doctors, oncologists, it just wasn't true. If you don't do what I say, you're going to be dead in 6 months. So you leave, and everybody so he doesn't know what happens to the people that leave. So he should never say anything about it. Okay, it's absurd. It's absurd. But anyway, so instead, our journey is this: we want to be healthy. We want to be optimally functioning. And in order to be optimally functioning, we need to have all of our biological, psychological, and spiritual needs being met. And we have to be very, first of all, we have to know what that is. What are our biological needs? And the reason that we have to sit here and talk about it is because we were kicked out of the paradise called of instinct. And so now everything we do has to first come from a place in the mind that's not real, a concept. And those concepts are usually called, Freud referred to it as the superego. And I think in family transactional analysis, they called it the adult. But it's basically all the shoulds and shouldn'ts, right? So, like a baby doesn't have a superego yet, but a baby doesn't have shoulds, right? So a baby is hungry and it sees food, it's going to grab it. Oh my gosh, that was on Uncle Charlie's plate. That has no meaning to them, because that was a should, that was a shouldn't. Okay. Anyway, my job is to really help you change your language, and that's what I do when I train doctors, is really change their language. The protocols are cool. I mean, they're not very nice, but the number one thing that happens, please, everybody realize this: if you've got chronically fermenting cells, those are the fruit on the tree that goes through your psycho-spiritual roots. All right? And you must work on the human being as in its totality, which is a mind-body-spirit complex. The mind, body, and spirit are not separate. Okay, because when you analyze what a body is, it is molecules made of atoms, which are protons and electrons and neutrons, and they're all flying around each other. And most of an atom, like 99.999% of an atom, is space. So that's what we call physical. And what do we call mind? And where does one end and one begin? So what I'm saying is what humans are is better understood as a mind-body-spirit complex. So we have to deal with all sides of that. And so we have to be very careful that we don't injure and hurt the mind with bad concepts. And when I say bad, I mean a concept that's going to cause pain. Verify to continue. I don't know what they did. They said verify to continue. I had to I had to I had to do a jigsaw puzzle here. Yeah, it's great. I'm telling you, artificial intelligence, which we call artificial intelligence, it's really something else. It's artificial. Uh, it came from us, right? God made nature, and we make artificiality. And one of our most proud is this machine here it's able to think. But it got the worst of us. We gave it the worst. We gave it that part of us that has no superego. Anyway, um, so here's our journey. Our journey is to be healthy, and to be healthy, we need to follow our biological requirements, psychological and spiritual. What are our biological requirements? That we eat the food for which we were adapted. How do we know? We look at our anatomy and physiology because we don't have instinct anymore. And we look at our anatomy and physiology, and we could do it. We can actually take a course in comparative anatomy and physiology, and you'll see where we fall. Because remember, anatomy and physiology is based upon how the organism consumes, what they consume, how, because they have the apparatus, the appropriate apparatus to deal with it and to get some energy and nutrients from it. Yeah. Okay, so the apparatus that we have is different than the apparatus that, let's say, a maggot has. So whereas a maggot may enjoy and be capable of living in garbage or feces and eating it, it suits its anatomy and physiology. It doesn't suit ours. That's just an example. Okay, so you find out what you're diurnal, not nocturnal. Oh, you should go to bed right after sunset. So anyway, you just look at your biological requirements, and don't believe me, try it. Do that for 1 month, and you're going to be a brand new being. Okay, and psychological just means that you are you're not too introverted, and you're not too obsessed with yourself and your own thinking and all that, because the more you're self-absorbed, the less joy you will have, the less happy you will be. Okay, when are we happiest? When we're with friends or people we love and we're expressing and sharing, right? But if you're self-absorbed, you can't do that. So the degree to which you're self-absorbed is the degree to which you're not satisfied and not happy. So the road out of if you're alone, let's say you don't have family or friends, and you're feeling, and you're all like, my life is so terrible. Okay, the road out of self-obsession is compassion. So go find some people that you can help in any way, and get out of yourself, and you're going to find yourself getting happier and happier. Now, our spiritual needs, there's no need in spirit. Our spirit is pure, untouchable, never born, never dies. It underlies and is in between and is the fabric of everything else. So really, it's just restoring harmony between the body, the mind, and its ground or its substance called spirit. Now, anyway, we're going to answer some questions, I promise you. about CFCs. Now, first question is, oh God, that got so big. What happened? What the heck? My God, it's ridiculous. Okay, and where's the? You know, a lot of you are always asking about um, how can you know, like, how do I follow up on myself? How do I evaluate whether I'm doing okay? How do I know if I'm doing okay? And what I wanted to let you know that is that all the tests that your doctors use are standard tests and are really suboptimal. So looking at tumor markers um, is not going to help you because you don't know what a tumor marker means. Nobody knows because by its biology is not. It's not that that we were given tumor markers because we were going to have tumors. They serve another purpose, and they just found that in some occasions these antigens or tumors that we find in the blood are associated with this with uh, uh, chronically fermenting cells that began in the colon. But you know what we find? That's called CEA. We find it in breast. We find it in lung. So they're all so anyway. And also, if it's going up, does that mean that the CFCs are growing, or does that mean they're dying so fast there's more in the blood? We don't know. So we look at other things, and I'd like you all to start looking at things. One of the things you look at is LDH. That's on most tests, most standard chemistry tests, and that's lactate dehydrogenase, and it's the final enzyme in the pathway of fermentation. So if that's increasing, then your CFCs are eating. There's more of them. So I watch that going high. So if the tumor marker is going high and that's not, then I'm not sure what it means. The other thing you look at is ferritin to iron ratio. Ferritin iron ratio, if it's 5 or greater, that means there are CFCs around. You want to get the ferritin to iron ratio below 5. That means you divide ferritin by iron. So another one is thymidine kinase, but that we can't usually get that test anywhere. I think only in research. But another one that is kind of a clue is called the NLR, the neutrophil to leukocyte to lymphocyte ratio. So there are white blood cells, right? We have a total of, you might have a total of anywhere from 4.5 up to about, depending on the reference, 10 or 11, or 9.5 or whatever, is considered in the normal range. Doesn't mean it's healthy, it's the normal range. Now, in the white blood cells are neutrophils, lymphocytes, eosinophils, basophils, monocytes. I think that's it. Okay, so they all have different functions. The white cells are the immune system. So the neutrophils are usually the most abundant, and their job is, they're called phagocytes. They go out and phagocytize, which means eat. They're also called granulocytes. So they go out and eat. So they're part of the innate immune system. So when you get, you're sick with a fever, and you have, let's say you have a wound, or some kind of bacterial situation that's disturbing it, your neutrophils increase because they're going to gobble up stuff. Your lymphocytes are the white blood cells that turn into T4s or T8 cells or T17 or Tregs. And then your CD56 is the natural killer cells. But that's not even on the differential. It might fall under the lymphocyte, and so does the natural killer cell. Anyway, so the lymphocytes, right, the T cells and all that are what give you adaptive immunity, and it's cellular immunity, and that's going to really end the whole chronically fermenting CFC situation. However, the neutrophils need to go in, and like, for example, if you're a that's what happens when if you've gotten high doses of chemotherapy, and your white count, your absolute white count goes below 2,000 I have to give you something to get it up. But standard oncology, they wait till it's about 0.8 or something. And of course, so many times it's too late. The person dies. Because the neutrophil is going to eat any bacteria they get in your blood. So if you're brushing your teeth and you're just brushing hard and the bacteria go into your blood, if you're constipated and you put a lot of pressure and you get during a constipated bowel movement, bacteria gets into your blood, the neutrophils are gobbling them up quick. If you bang your elbow and it starts to bleed, some bacteria get in there or whatever, and you have to have neutrophils. So if you have low neutrophils and you can't do that, you can get what's called spontaneous sepsis. But the other thing looking at the neutrophil to leukocyte ratio is telling you that, because neutrophils are also associated with chronic inflammation, because they're like a real cardinal sign of inflammation. So now the problem with the neutrophil is this: neutrophils are usually the first ones on the scene of a situation, and let's say they arrive at a place that's really a mess, a wound, and they arrive there. You might not see the neutrophils go up for about 12 to 24 hours, but then they start going up, and they go really high because they need to eat up all this debris. But we're looking at but with regards to CFCs, here's what's happening. Even though the neutrophils are necessary, because if they get into your blood, you'll be dead. So you got to have enough neutrophils. So they give you a shot called Neupogen, and Neupogen is colony stimulating factor, and it stimulates the part of the bone marrow that's making the specific white blood cells called neutrophils. It has no effect on the lymphocytes or the monocytes or platelets or anything. So you want them to be strong, but on the other hand, they help tumors. When they get into the tumor microenvironment, they become tumor-associated neutrophils. Now what they do, because once they get into the tissue bed, what they do is they made it easier for now other immune cells to come in. I mean other tumor cells to come in. Okay, so they promote tumors to grow, and they promote them to spread. Okay, because once they're in the tumor microenvironment and they're in tumor microenvironment, which has low oxygen and high acid, they become TANs, tumor-associated neutrophils, right? And one of the things they do is they produce certain cytokines that actually turn off CD8 cells, which are your active T cells that have already had either a DC cell or a macrophage present to them, the fingerprints and the retinal scan and all that. Is called antigen presenting cell. So now that lymphocyte is activated. Well, the neutrophils can turn them off once they get inside there. Yeah. So as the neutrophils increase, the lymphocytes decrease, you have less and less of the cellular immunity you need to save this situation, and you've got increased inflammation, and total body inflammation is not good. So they look at the NLR, neutrophil to lymphocyte ratio, that the higher it goes, it's unhealthy. All right. And so what is an increased neutrophil count? Because if you look on a blood test, you'll find out that your normal, if you look at under the absolute neutrophils, the normal number of neutrophils is anywhere from 1450 to 1790 or something like that per microliter, right? If you go above 7500, it's called elevated neutrophils, right? When the total body white count goes above 11, that means you have total body high white blood cells, which means leukocytosis. But what's this telling you is that there's something going on, an inflammatory response is happening. But at the same time, at the expense of the lymphocytes. So the higher the NLR is, that means the worse you're doing. Okay, and the the neutrophils, when they get in, they produce cytokines, which are chemicals that increase tumor progression, and they can also, as I said, directly suppress cytotoxic T cells. Yeah. Then they did studies where they were looking at different ethnicities and different locations of CFCs and all that sort of thing. So it's not, and there's some differences. So it's not like a tumor marker. However, tumor marker is going up, and the person's looking good, feeling good. So you say, well, let me look at the LDH, let me look at the ferritin, an iron ratio, and let me look at the NLR, neutrophil lymphocyte ratio, and then putting them together and using them to get some idea of what's going on inside. All right, so that's very, very important. When the neutrophil first arrives out on the scene, it's got these metallo-metal complexes that they call it MMP8, MMP9, and they go in and they just loosen up the junctions between the cells, so the cells get loose. By doing that, you promote metastasis. So now new CFCs can arrive, right? They also found out that they produce something called myeloperoxidase, which then produces hypochlorous acid, which can inactivate proteases, which are there to help their enzymes. So there's lots of it. I mean, the TGF beta is shown to increase epithelial to mesenchymal transition. You remember that, EMT? That's what high-dose chemo and high-dose radiation do. They take a mature breast or brain, whatever, CFC, and they will change it from its form, which is epithelial, meaning adult, to its stem cell form, meaning mesenchymal. So it turns an adult into a stem cell so that it can go metastasize. That's one of the things that the neutrophils can do. So on the one hand, without them, you're dead, and on the other hand, too much. And this is just another reminder that we will never, ever understand the body. It's far too complex. IL-6, coming from the visceral fat around your organs, produces a lot of harm. But IL-6, after exercise, is going to help you maintain the benefits. So depending on the environment of where something is, it's going to, I don't know, maybe I'm too much for you guys, but I just keep thinking that people want to know. So here's a question. I have white worms coming out of my nose daily, especially after eating, about 2 hours after eating. They are getting worse. I can hear them in my sinuses at night. I took albendazole and I woke up with a rash on my throat. I had root canal that resulted in upper sinus showing moderate thickening. All right, well, root canals will definitely do that. As you all know, root canals are when they take out the center of the root, which includes the blood vessels, the lymphatic vessels, and the nerves. And so now you just have a piece of dead tooth. They fill it up with cement and they put a cap on it so that you can have chew and swallow. But what happens is, what is this? Oh, low battery. My God, it never ends. Oh, thank you on the Jonathan Otto thing. That came out already, I see. That's great. Yeah, I like him. He's a great guy. Yeah, there we go. Yeah. Yeah, thank you about that with John Otto. He's a great guy. So I don't know if you all saw that, but he was interviewing a few people. And I was one of them. And we had a good talk. So I think it's out now if you get a chance to see it. Anyway, so when you're with if you can't depend on your doctor to look at these things, they will not. Can you believe it? This is their field, oncology. They will not even look at it. So you just say, look, included in my test, I want a ferritin to iron ratio, or just show me the ferritin and iron. I can divide. I'll figure out the ratio, and I want to know the nucleoside, the absolute number of neutrophils, and the absolute number, not the percentages, of lymphocytes, and then you look at the ratio, right? And if it's getting too high, it's going to be unfortunate. So um, the other thing that neutrophils do that's pretty terrible is that they mobilize. There's an enzyme called a hydrogen pump ATPase. Now, hydrogen without a electron, so just a naked proton, is acid. So H. So when you talk about pH, it means the relative concentrations of hydrogen protons. What do protons need? They need an electron, so they're going to grab electrons. And the alkaline stuff comes by and gives them electrons, so they're a good couple. They like each other. But anyway, by the neutrophils causing the tumor microenvironment to upregulate the ability to produce hydrogen ions, in other words, to make it more acidic, winds up inactivating natural killer cells. So really, you want to look at your NLR, your nucleoside to lymphocyte ratio. All right. So you have these words coming out of your nose, especially after eating. They are getting worse. I can hear them in my sinuses at night. I took albendazole and I woke up with a rash in my throat. Oh, and I had a root canal, which resulted in upper sinus showing moderate thickening. All right, so if you if you have worms coming out of your nose, and um, um, you can't just be on albendazole, okay? You need to be on at least 3 anti-worm, anti-helminthics. And I wouldn't choose albendazole. I would choose probably mebendazole. It's a cousin. Like 500 milligrams 3 times a day. I would choose ivermectin for sure, 12 milligrams 3 times a day, and I would use maybe niclosamide or praziquantel to get the worms. And then I would have something to get the protozoas, such as tinidazole and nitazoxanide. And then you want to add at least one antifungal like fluconazole a couple times a day. So what does this say? Is metronidazole safe to use for 3 weeks? I read about possible neurological side effects and was concerned it might cause some damage. What's your experience with the safety profile? Is ivermectin safe for long term? All right, so yeah, this is from John. And metronidazole and tinidazole are very close cousins. I don't use metronidazole much, but it's safe. I use the tinidazole more because it's a little bit better at getting the worms. I mean the protozoa. Protozoas like entamoeba or toxoplasmosis, other kinds of protozoas. So I would use, mebendazole and nitazoxanide if I thought I had a lot of protozoa. And you all know what, I forget what they call it. Anyway. All right, so that's that question. Is ivermectin safe in the long run? Yes. about 250 million people a year are infected with they have uncle psoriasis, which is river blindness, and you know they take ivermectin, in large doses, like 12 milligrams 3 times a day, for 10 or 15 years. They keep doing it because they keep being re-exposed. So I think 250 million people doing something for 10 to 15 years, I think that qualifies as a clinical trial. And so I would say it's absolutely safe. So what I was wondering, when treating parasites with the parasite meds, how long would you do 3 weeks on and 1 week off? Also, do parasites become resistant to drugs? And is the rifamycin just as effective at killing parasites, especially in the brain and other organs? All right, so this is from Lauren, and uh, you do the 3 weeks on, 1 week off, depending on your situation. And it's really good if you have somebody that can work an electrodermal screening on your hands to pick up the energy, or an acupuncture meridian assessment like Dr. Simon Yu does. We do that as well. And there are many people. You can actually call Dr. Yu's practice and ask who he's trained nearby you that he thinks might be good. But so things are getting worse. So what I was meaning is that because you're taking only one, it's not enough to kill them. Because remember, these guys have 2,000 eggs. They lay 2,000 eggs, and each egg can become thousands of the other ones. So you got to keep 3 weeks on, 1 week off, 3 weeks on, 1 week off, and you use multiple different um, antiparasitics. So I would use ivermectin, mebendazole, niclosamide, and praziquantel. That is going to get everything. Then I would also use, for the antiprotozoals, probably tinidazole and um, nitazoxanide, and then an antifungal like uh, fluconazole or nystatin. Now, is the Rife machine just as effective in killing parasites? Yes, absolutely, if you knew the right frequency. And the problem is, nobody knows the frequencies. Nobody knows Rife's frequencies. When they raided his office, they confiscated his incredible camera with quartz lenses that was able to magnify 60,000 times. So the normal microscope is 2,500 times. So he saw things that other people didn't, but what his microscope could do, it could then measure the frequency coming out of the organism, the parasite. Send the same frequency back, and it's dead, because they're additive, it like exploded. The other thing you can do is send this frequency that's 180 degrees out of sync. So when they arrive at each other, one's this way and one's the other way, and you got a neutral line. They're dead that way too. So yeah, but we don't know what they are, so we just kind of sweep, right? And they just sweep. And if they see someone getting really sick at a certain point on the Rife, then they're assuming that this is a Herxheimer reaction, meaning that your body is killing it and releasing toxins and stuff. And I'm not so sure. I have to see the whole story. I was working when treating parasites with the parasite meds. How long would you? So you keep doing 3 weeks on, 1 week off, for, I would say, if a minimum of 6 cycles, but more likely 12 cycles. And then you've got to go somewhere to get an AMA test, acupuncture meridian test, to find out, because we have no instruments, medical instruments, that can measure their presence and what these um, these devices that are like called electrodermal screening by Vol or the acupuncture meridian assessment. What they're doing is they're picking up energy deficits. If there's a certain circuit in your body, for example, the circuit that goes through your, like the wisdom tooth goes through the heart and small intestines. The one next to it goes thyroid, breast, stomach, and then on one side of your body it's spleen, the other side it's pancreas. But it goes right through there. So Lauren, what Rife was able to do, his name was Royal Raymond Rife. What he was able to do is measure the exact frequency, and so he did this with what they call terminally ill people with CFC, and they gave him 16 of them, and all 16 were completely cured, or not cured, but back to health. But his treatment was only 3 minutes every 3 days because he had the exact frequency. When we're using frequency generators, we have to sweep and all that stuff, and so it's really too bad. I mean, I'm not an engineer. I wish I was, because I would have engineered a few things, such as the bark of the beast is coming, and I would have learned how to do this as well. So now, I'm taking Eliquis 2.5 milligrams twice a day for DVTs I've had. I do not have one of the factor 5 genes. So, well, Eliquis, the way Eliquis works is it inactivates in the clotting cascade. When blood clots, it starts with fibrinogen and it goes up and it goes through different levels of thrombin and things like that, and it finally forms a clot. And there's different factors involved in that. So what the Eliquis does is it blocks factor XA, and therefore it prevents the clot from forming. Now, you have factor 5 problem. So if you have factor 5 problem, that can be either way. There's two kinds of factor 5. One can actually increase clotting, one can increase hemorrhaging, not clotting. But there have been cases of people who had no factor 5 problem who took Eliquis and they developed a factor 5 problem. So your question here, so it looks like the question is, I'm taking Eliquis 2.5 milligrams twice a day for DVTs. That's deep venous thrombosis. Thrombosis is the word for blood clot. Deep vein means veins that are not superficial like on your arm, but they're deep in your thigh or deep in your pelvis like that. They usually have a much wider bore. They carry more blood. So if you get a thrombus there, a blood clot there, it can go right up to the lung and cause you to stop breathing. So it can be dangerous. So you've got to try to get rid of the deep vein thrombosis if you have it. So she was put on Eliquis, which is the attempt is to stop the formation of these. And then she's taking nattokinase, which stimulates pepsinogen to break down clots. Because remember, you have one side that makes them and the other side that breaks them down. So with the factor 5, I don't know about the Eliquis. I would probably stay away from it. And I would just rely on nattokinase, and you can also take lumbrokinase. Take like three nattokinases 3 times a day on an empty stomach. And do similar, give it a good 20, 30 minutes, and then take a couple of lumbrokinase. Those will be breaking down anything that's forming. So it doesn't matter if you're going to increase blood clots, it's going to break them down before they become a problem. But you really got to get your blood testing and supervised by a doctor who understands how to use these. It's really difficult for me to give specific medical advice since I can't monitor you, and I can't really tell you I can say we should start on this regimen, but I might find by the blood test next week that we have to modify it. So it's really not safe to do that, and I can't do that. But you've got to find a doctor. So I would agree that you should get off the Eliquis. I would agree that you um, should do something, the ivermectin, and you can add lumprokinase. And back with the other lady with the worms, as I said, do all of those and the antifungals and the anti-protozoas. Okay. And this is from Daniel. 2 weeks ago, into a parasite clan, I was seeing signs of jaundice. The whites in my eyes were yellow. My skin was looking a bit yellow. I had been taking the recommended dosages of ivermectin, benzazole, nitazoxanide, fenbendazole, tinidazole, and niclosamide. If it had been 2 weeks instead of 3, but I switched to the antifungal to give my liver a break. Can I start the antiparasitic program again? Well, I don't know where you are. I wish you could get in touch with Dr. Yu or get over to our clinic or find someone else, find out if Dr. Yu trained anyone else, because they can actually test which ones. There might be one in there, one of the ones you're taking that's causing a problem. It's hard to say. Of the medications, I mean. So it's hard to say. But if that is, they could, use this device to figure out what you should take. But if you just go to a regular functional medicine doctor, you can tell them what's happening. And remember, if you only give one drug, albendazole or whatever it is, ivermectin, one drug, you're going to disturb these guys, and they're not going to die. They're just going to move to other organs. They're going to migrate. Not what you want. But anyway, so this guy here, Daniel, you're 2 weeks into a parasite cleanse, and you were seeing all the signs of jaundice. So so what I'm saying is that the reason you could be, one of the reasons you could be, if it's due to the drugs, is that all of those drugs are cleared by the liver. Things can be cleared by the liver or the kidney, right? But these are all cleared specifically by the liver. So you're taking a lot of different drugs at the same time. So it might be too much for you, and you need to tone it down a little bit. Did you have your blood test to check your bilirubin? That would be the way to check that. Is your urine dark? Because that could also be a sign of hepatitis. It's hard to know. But I hear you. I would go with. I agree with you with this. Probably the antiparasitics. So, okay. So, can I continue the parasite program with the medications or change the dosage? Anyway, you need to change the dosage. It's overburdening your liver and you're getting jaundice. So that's gone a little too far. I haven't really seen that before. So I was wondering what your liver function was like before you started all those. So really what you need to do is you need to get a doctor that you can trust to work with. If you could, do a consult with me and I'll help you. Or find a doctor really that's close to you that can really work with you, and I would collaborate with them in case they didn't know enough about this. But it sounds like if you're on ivermectin, mebendazole, nitazoxanide, fenbendazole, tinidazole, niclosamide, okay, I'd say you can knock out the fenbendazole. I mean, that's what I would start out with. And I mean, maybe it's hard to know what you're reacting to. What you could do is another way to do it is you could stop them all and then start with taking just 2 of them and see if anything happens. And then add a third one in about like at least 5 days after realizing that everything's okay. Right? And then you can gradually increase like that. Vitamin C. You mentioned vitamin C for CFCs. I have CFCs of the DCIS variety. That's ductal carcinoma in situ, which is in the duct of a breast. That's considered stage 0. I also have high ferritin levels, though. Is vitamin C contraindicated? Also, you've spoken of iodine, but I also heard long-term use will cause Hashimoto syndrome. It's all frustrating because I feel everything that is good for me, uh, or or that also causes some other sort of damage. I'm trying hard on this health journey, but it seems like there's too much conflicting evidence. Help, please. Okay. You said you're taking vitamin C. You've got to take vitamin C in the powdered form, the sodium ascorbate. And Misty, I don't know how big you are, but if you're like a small to average woman, you can take 8 grams a day, but you're going to put it in a liter and you're of powdered sodium ascorbate, and you're going to sip it slowly from 7 a.m. to 7 p.m. You can't finish that bottle before 7 p.m. That means you just take a sip like that. Okay, so you can absorb it all. So you got to take vitamin C. You can also then go get vitamin C IVs twice a week, 3 times a week. How much do you take? It depends on your plasma level. Remember, you want your plasma ascorbate level to be at least 350 milligrams per deciliter. Okay, when you get above 450 milligrams per deciliter, there's no added benefit, so there's no need to go above it. So anywhere between 350 and 450 milligrams per deciliter. Make sure it's in those units, not millimoles per liter. So if you're not sipping 7 to 7, then you're going to have a big physiological deficit. So when you sit down to get your IV, most of that IV will go to fill up the deficit, and you won't be able to get it to the 350, the pro-oxidant level, unless you're taking like a 200 grams or 150 grams. But after 2 to 3 weeks of sipping 7 to 7, you should be able to achieve that with 50 grams or 75 at the max. Now, is it contraindicated with high ferritin levels? Well, first of all, why are your ferritin levels high? Do you have hemosiderosis? If you have hemosiderosis, which is a condition where the body is unable to get rid of iron and it accumulates mostly in the liver, then high-dose vitamin C would not be a good idea because it's going to cause destruction. But if your ferritin is high, like most people, due to the fact that you have CFCs, but and your iron levels are normal. But why is your ferritin high? Then I don't know. When you say high, I don't know. Because remember, with someone with CFCs, they could have a ferritin to iron ratio of 10, 12. So you could have ferritins in the 2000s, 3000s. They can be really high or even higher. But you first must make sure that you don't have a condition known as hemochromatosis, because then you would not take a lot of vitamin C. So you have to know that. Now, with regards to the iodine causing Hashimoto's, okay, the way you take iodine, and I guess this goes for a lot of people that you should, hopefully everybody's going to be listening. The way, okay, so the way you take iodine is, we all have an iodine deficit. Okay, iodine is the prize, the delivery. It's what the thyroid is all about. It's about delivering iodide, the anion, to the mitochondrial membrane of every cell that activates it to start working. It depolarizes the mitochondrial membrane, which produces energy. So if you have not enough of it, you'll be tired. If you have too much, you're like this. The problem is that we don't get enough iodine in our diet. Japanese do, 13.8 milligrams per day. We get in the micrograms. I think they put it in Morton salt or something, a small amount. Not adequate. So our thyroid gland grabs things similar to iodine, like chloride, bromide, or fluoride. And so even though you have a T4 and T3 that are normal, unless you do a mass spectrometer, you're not going to know if those are iodines or bromides or what. But if they're anything but iodine, they're not. You're still, even though you have normal numbers, you're not going to be functional. So we've got to give you iodine. So I say start with 25 milligrams. Now, also keep in mind that iodine suppresses thyroid output. That's why it was used as the treatment for Graves, where people had really high a thyroid, because it'll block it. So what you do is, before you start taking the iodine, or you can start the iodine for about 5 to 7 days. Then you get a thermometer for your armpit, axillary thermometer. You check it every morning before you get out of bed, before you walk around. Then you write it down and you average it over 5 days. And if it's less than 97.8 Fahrenheit or less than 36.8 degrees centigrade, then you are hypothyroid and you need to take something. You can get Westroid, you can get Armor, you can get Thyrovance, Thyrovanz. You can get that online. And you take one in the morning, empty stomach, like 75 milligrams. And you keep taking it, and then in about 10 days, you check again while you're taking it. If you're still low, then you take another one in the afternoon, maybe 30 minutes before you eat. You do that for about 2 weeks, and then while you're taking both of those, you take your basal body temperatures again. If you're still low, you might have to add a third one in the morning. Some people go up to 2 and 2 or whatever you need to get you up to a normal body temperature. So if you go get a blood test, your TSH is going to say, oh my God, 0.001, and your endocrinologist is going to freak out. They're going to say, stop. The reason the TSH is low, because it goes in the opposite direction of thyroid function. The reason it's low is because it's getting messages from the inactive thyroid that your thyroid's producing, which has bromide and fluoride and stuff on it. Plus, it's getting messages from the iodine you're taking. So the TSH says, oh my gosh, we don't need to make any more, because TSH from the pituitary is called thyroid stimulating syndrome hormone. So it stimulates. So the higher it is means it's trying to stimulate. The lower it is, it says no more stimulation. So if you went to an endocrinologist, they say, oh my God, you've got too much, you're taking too much, but it's not. We're looking at the body temperature. How do you know if you're taking too much? You'll start to get an increased heart rate. You'll start to get just kind of hyper and stuff. You don't want to have that at all. Then you are taking too much. The problem is you can't trust the blood test, but you don't have to. As long as you're compensating with natural thyroid hormone while you're taking the iodine. It takes about 1.5 years, 2 years to get enough iodine. Then you can start weaning off the thyroid medicine. Or you can just start with 12.5 milligrams a day, which is less than the average Japanese eats their whole life. It'll take much longer to replenish your deficit, but it will ultimately. All right, and then, I think I answered that question, right? I'm trying to. All right, Misty, if you have any more, send me another question. Marie, if I have multiple pancreatic cysts and I don't do a biopsy to see if they have become malignant, but I continue to lose weight, or at least not gain any weight, wouldn't that indicate that there's probably malignancy there? The method is Whipple surgery, I know, to remove the pancreas. How else can one heal from premalignant pancreatic cysts that are potentially high risk for malignancy? My gallbladder was 19%. I'm not sure, but everyone with malignancy seems to have to get a Whipple surgery. Is there another way of managing it? I currently doing ivermectin benzol, but assuming it's not working for pancreatic cysts. I can't find Prasi and other horse paste. Trical benzodol for pancreatic. No other, and I can't get doctors to prescribe it. And so they suggest I take Marinol, which is synthetic THC, to increase my appetite and gain weight. I have an appetite and I eat. Very concerned about my weight. Any feedback? All right, Marie. So a few things going on here. Number one, a cyst is a cyst. not necessarily a premalignant lesion. They don't really know what they're seeing when they see a cyst. We find them whether we're doing ultrasounds or MRIs or CT scans or whatever. We always get uh, the radiology. Let's say we're looking at the liver because it has trouble, and we say, oh well, there's a couple cysts on the kidney, but then no one ever says anything about them because they're considered benign. It's my sense from everything I've learned and experienced over the years that a cyst is a home for a parasite. So I think you're very correct in considering that. Now, you don't need a Whipple procedure. Get that out of your mind, right? I mean, if you did, there are situations where I've seen the entire duodenum blocked up. The person can't eat. They do need, but you don't even have pancreatic CFCs, right? You have cysts. So you're not taking enough. You need ivermectin, mebendazole, praziquantel, maybe niclosamide. So where do you go? You go to alldaychemists.com, which is in India. It's a reputable place, and you can get the antiparasitics for about 25% the cost of what you're paying now, or what you would pay if you had them all. You can get everything from them. So I would do that, and I would work heavily on that. And I would want you to get it out of your mind what they put there. They cast it. It's sorcery. They told you that if they said that you have pre means it's going to happen. Well, that's just not true. And first of all, those are not. Pancreatic cysts are rare, and the pancreatic CFCs are not rare. So whatever they're telling you, and don't get a biopsy because if there are any CFCs, they're going to spread. So the thing to do, you can do a PET CT. A PET CT. The CT will show you the anatomy of these cysts, how big they are, and it'll show the SUV, which is the standard uptake value, and they'll tell you if it's too high, then you have to start thinking that. But that's one way of doing it. I would just get on all the antiparasitics you can and call that or get in touch with alldaychemists.com. Now, Marinol synthetic doesn't work ever. Just go to and get medical marijuana, get a vaporizer, and use that, and take one puff of a good quality marijuana with THC, and you'll eat. Remember, it's the parent. You want the real deal. You don't want to. If the parent is available and it's legal, then you really don't need to think about taking Marinol. I never gave it because it was terrible. It didn't work. Okay, so here's John. So you can get real cannabis, is what I'm saying. And about your weight. Now listen, you say you're losing weight, but what are you eating? If you're eating healthy, if you're eating uncooked foods, and you're eating in a 6-hour window, then maybe you're still your body's still balancing down to your most healthy weight. I'm not sure. That might be what's happening. I don't know your situation enough to give you enough information, but you say you're hungry and you're eating. Does that mean because that's good. Are you eating healthy food or are you eating unhealthy food? So there's so many unknowns that I can't give medical advice under situations like this for sure. I would have to speak to you and know more about you to know what's the safe way to continue. Okay, so Misty, I hope that makes sense. But you need to have more than just two. You got to get many so you don't, because if you just disturb them, they'll migrate, they'll get worse. You got to really hit them hard. And for you, I would do 3 weeks on and 1 week off for at least 12 cycles. But again, you've got to have someone monitoring you. You can't just do this without that. Oh, wow, it's 7:10. Since we had a little trouble starting, you guys, do you all want to stay a little bit longer, or are you done? I can hang up if you want. Hi, everybody. So cool to see everybody. Uh, has anyone found a Dr. Lodi, or a doctor that will prescribe? Stay longer. Okay. So, well, what I was thinking is this. Uh, for all of you, remember if you saw my webinar on parasites, I talked about an Indian pharmacy that was called 1mg.com. Now they don't require, you don't have to call them with a prescription, but they will assign you to. They have, like, I don't know, a whole staff of Indian doctors. They'll assign you to one that you'll talk to on online, and they'll give it to you anyway. That's 1 milligram. There's another one called All Day Chemists. You don't even need that. All Day Chemists with an S at the end.com, and you can order through there. So you can get all these. So you don't need to have a doctor. But what you want to do is you want to be able to get your before you take it. Just get some liver functions and see what your liver functions are. Your AST, your ALT. That's all you need to get. AST and ALT. If you get those, you know. Now, if they're really high, I wouldn't do it. I would have someone guide you through it for sure, who knows what they're doing. There's the trick, finding someone who knows what they're doing. Um, so, but at least I know you can find out where to get it. But it's good to have someone at some point be able to check your your liver function test to make sure you're not going too high. Um, but remember, that's why we do 3 weeks on, 1 week off. We keep giving it a break. And remember, while we're taking these medications, because I hate medicine, but this is like the only time I use them. I really don't like medications. I prefer vitamin C and things like that, fasting, cleansing. But anyway, while we're taking the herbs that are super at protecting the liver, silymarin, I do like 500 milligrams 3 times a day. Alpha lipoic acid that comes in an R and L form. Alpha lipoic acid, I would take 400 milligrams 3 times a day, and take 1 B complex with it. Take selenium 200 micrograms a day, or eat a bunch of Brazil nuts. And then you can take something else called phosphatidylcholine, which I think they have in pills. But if you find a good doctor who can give it to you IV, it's good. You don't need that one. But I'm telling you, the ALA and silymarin are amazing. Now, in Germany, in the German pharmacopoeia, silymarin, which is the plant that's also milk thistle, which has got silymarin, which has silybinum. Those are just different chemicals in the milk thistle plant. In Germany, it's part of the pharmacopoeia, and they have it in a liquid called Legalon that you can inject intravenously, and that's what they give to people when they eat Amanita phalloides, which you may know as the death cap mushroom. And you may have heard of families that are out camping and they pick a mushroom and eat it, and they all die within 48 hours from liver failure. Well, that's what they use, and it counteracts it, and we can't get it here. I used to have it sent from Germany. But over here, what we use, for example, if a young girl, all I remember in residency was young girls were committing suicide over a boy issue. Listen, my heart goes out to women, because it is so much easier to find a good woman than to find a good man. And it's not that the men are bad. It's just that their hormone systems of men is crazy. It's really hormones. And the only way you would know is if I gave you 250 milligrams of testosterone intramuscularly every week. After about 3 or 4 weeks, she would say, I get it. I mean, because I actually saw that with one of my nurses. She got the wrong, her and her husband mixed up their hormones. I'd given them both hormones, and she was taking her husband's hormones, and he was taking hers. And she came to me one day and said, Dr. Lodi, I always want to have sex, and he doesn't. It was really unfair. But I was walking behind her in the hallway, and she had this V shape to her. And she was, and it took 9. I said, what's going on? And and then I figured out. I said, somehow they switched it. This poor guy didn't want to have anything to do with it. And she was going crazy. So they switched it back, but it took her 9 months to get back to normal. So, but I'm just saying, young men, I mean, 40 and under, 50 and under, maybe. I mean, I know it sounds, you might not like to hear this, but it's almost as hard as for them to stop being that way as it would be if someone said to you, okay, stop menstruating. I don't want you to menstruate this month. It's like, what? It's these hormones, they're crazy. I'll tell you, I'm glad I'm older. I don't have to have such high hormones anymore. At least now I can think. So but anyway, I feel bad for women because they have to put up with men, and it's very difficult. Um, pancreatic cyst. Okay, so this is John. Did we talk about John yet? John, 75-year-old male, 160 pounds, excellent health. Yay, excellent health. PSA has ratcheted up from 2 in 2021 to 5.2 late 2023 to 8.1 early March 2024. Just started the Tippin protocol. I have no diagnosis yet as a delay getting appointment with urologist. Don't want a biopsy. What scan, if any, do you recommend? Should I start ivermectin? And if so, should I go with 24 or 36 milligrams a day? Well, I would start 12 milligrams 3 times a day, which is 36. And if you go to a urologist, he's going to want a biopsy. And if you get a biopsy and it is CFCs, it makes it spread. But your PSA going up that high, now he should be able to tell on a digital exam if there are any masses or is it just diffusely enlarged. Now, prostate CFCs sometimes don't show up on PET scans because they're not predominantly using glucose. They could be using glutamine. But what they do is they have a special MRI test for the prostate. So there are ways to image it. You just tell your urologist, like, I'm not getting a biopsy. So if you can give me a prostate MRI, or if you think I should do a glutamine PET scan or whatever, yeah, you don't have to. But in any case, another thing for prostates, remember, men, even though your libido has gone down, your testosterone has gone down, you still need to ejaculate 21 times a month. So you better get some testosterone so you'll be in the mood for that. But yeah, the ivermectin and the whole, not just ivermectin, remember, you've got to do them all. If you undertreat, you cause them to migrate. So, well, I don't know what to say. You have an appointment to see a urologist. Appointments can be broken. If you want to get a biopsy, you should go. But you said you didn't. So basically, I recommend, I'm not sure where you live, but I recommend that you get um, It depends. Your PSA could be going up also because of increasing just um, uh, congestion of the prostate. So it's hard to say. Also, about 95% of men who have an autopsy at the age of 93, even, who may have died from anything not other than prostate, are found to have prostate CFCs. So just because, even if you had CFCs, doesn't mean you need to do anything, because it's most often very benign. And if you do a number of other things, like you get vitamin C, you change your diet. If you're not eating healthy, then you got to change it. That goes directly to the prostate. You change your diet to eating human food. You get doing your vitamin C, iodine, vitamin C, iodine, and thyroid. Vitamin C, vitamin D, vitamin A, and melatonin are minimum. The rest is a beautiful diet. And also mushrooms to increase natural killer cell function. And then you need to do peptides, TA1, thymosin alpha 1, because if you're older, you're not going to be having enough T cells. And so your lymphocyte to your neutrophil lymphocyte ratio will be low. I mean, be high because you'll have more neutrophils in it. You want to get your lymphocytes up, you have to use TA1 because your thymus is dysfunctional at 77. Thymosin alpha 1, you can get it from peptidesciences.com. And you do. Each vial is like 10 milligrams of powder. You reconstitute it with 2 cc's of sterile water, they call bacteriostatic water. Then you take out 50 units in an insulin syringe and give yourself a little poke in the belly daily for 2 weeks, and then every other day. Get your T cells up. I would also encourage you and anybody else with CFCs to get a peptide called methionine enkephalin, which is met-enkephalin, which is a peptide that's 5 amino acids that's normally made in the adrenal gland, whose job it is to mediate between the immune system and the neuroendocrine system. But anyway, it goes into the tumor microenvironment. You know what it does? It fixes all that bad stuff. So those tumor-associated neutrophils that are making life miserable for the natural killer cells and CD8 activated cells, turns them back on, wakes up the natural killer cell, wakes up the dendritic cell, wakes up the macrophage. It's just great. Do that. Take good, if you can, do 1 to 2 colonics a week until you've done 18, and then do one a week for a while. So do 2 a week, and then 1 a week, and eventually twice a month. Eat human food. Okay, remember, we are earthlings. And so earthlings eat earth food. And get your testosterone up, get all your hormones balanced, DHEA, your thyroid, your adrenals, get them all balanced. It's like an orchestra. You can't just tune up the brass and the woodwinds and not tune up the strings. Well, we still got people on here. Oh wait, I just wanted to see that we're restored back to health and very. Since then, I've been taking calcium D-glutarate and DIM for the last year because the CFCs were estrogen and progesterone positive. I just had a hormone blood test and it showed that my estrogen was 172. Could it be because of the supplements I'm taking? Is this reason for concern? Is there anything I can do? You had intraductal, IDC intraductal carcinoma. Where is this thing? No. Okay, you're ER positive, PR positive because that's what all breast cells are. It's rare that it's not. Um, no, what you need to do is take and it's just intraductal carcinoma, right? Just ductal carcinoma in situ. It's like it hasn't invaded or anything. You take lots of soy. Men should do this too for prostate. The fellow I was speaking to a moment ago, was it John? Yeah, John. Prostate and breast are basically the same condition. They both go to the bones. They both are deal with estrogen, because it's not the testosterone; it gets turned into estrogen. Okay, if testosterone caused prostate CFCs, then the 25-year-old guy who has an erection all day at Gold's Gym should have it, not the older fellow who's having a hard time getting an erection. I mean, it's crazy to think that. But what happens as you get older, you turn more of the uh, your testosterone into estrogens. So anyway, you want to upregulate estrogen receptor beta, so you want to get lots of. Everybody needs this because we have estrogen receptors on colon, pancreas, lungs, bladder, stomach. Okay, so upregulate with. By the way, so does CBD upregulate uh, um, ER beta. Estrogen receptor beta shrinks tumors when that gets stimulated. Estrogen receptor alpha increases it when they get stimulated. Okay, so estrone and estradiol stimulate the alpha. When the testosterone is turned into an estrogen, it becomes estradiol. There's another male hormone called androstenedione. It turns into estrone. Both of those stimulated. So you get soy phytoestrogen, which are highly beta agonists and mildly alpha agonists. Why is that good? Because the beta wins out. The net effect is the beta. However, because it's sitting on the alpha, it's blocking it so that an estradiol can't go there and really sit on it. So, and then flax seeds. 2 or 3 tablespoons ground up and put it into a smoothie and however you want to eat it. Because flaxseed not only stimulates as an agonist for the beta, ER beta, but it actually down regulates our production of ER alpha. So it decreases our production of alpha. It's like, and then you eat cruciferous vegetables. Why? Because they are necessary for um, healthy estrogen metabolism. And then you also get iodine, right? Why? Iodine is a cofactor that converts estrone, which is an alpha receptor, into estriol, which is a beta receptor. So a woman can put 2 drops on each breast every day, 5% Lugol solution, and but the man's going to be taking orally oral Lugos as well. All right, let's see. So Nate, is that Nate? Yeah, you book a consultation with me. Yes, you can, but the reason there's such a long wait right now is because I'm in Arizona and working, and then I have already consultations in the morning and then at night, and um, 7 days a week. I just run out of time. So it won't be until I return that my schedule will open up for consultation. Uh, so anyway, you guys, listen. This is why we need these groups. Imagine I have a prostate group. So everybody who's prostate comes on, and I answer questions as if we're in a personal consult, as long as you understand that your information is being shared. But and I'm not going to tell you what to do. I'm going to tell you what I would do if you were with me or something like. The same with breast, the same with colon, and that way I think we can try to, because otherwise, there's no way I can see everybody, and everybody needs attention. So I get it, and I feel really terrible. So I want to do this. I'm trying to figure out how to, directly help as many people as I can. Even though I'm training doctors. All right, cool. So we got that. What do we have there? 107. We got whatever. All right. So blood CFC group 2. Okay. And I think a lymphoma group. Yeah, I agree. I think we maybe combine lymphoma and blood. They're very, very close. And we can even throw multiple myeloma in there. It's pretty close. Yeah, you're welcome. I really wish I could answer more questions, but you know. Oh, should I do? Let me do. I don't know. One more here. Let's see. Let's go. Look at I didn't. There's like I didn't answer hundreds of questions. Okay, listen. Anybody who's got a current condition that they're worried about, call an Oasis of Healing. Get online and go to stopmakingcancer.com. Get in touch. You'll speak to Andy or Maya. They'll set it up. They'll arrange a consultation with me. That is separate from my personal website, and that way we can get you helped right away. Okay, so if you've got a current situation that's not looking too good, you don't feel too good, please do this. And I'm speaking of you, Cassandra, because you need a second opinion. You certainly do. Uh, I know the plan is always the same. It's always the same. The plan is let's cut it off, then do chemo and radiation, and then maybe do a checkpoint inhibitor. And the result is always the same: a funeral. So, oh, I'm okay. I take that back. Not all the time, but okay. So your histological grade, moderately differentiated grade 2, modified Bloom, Richardson. All that means nothing. Tumor size 0.8 centimeters. They're scaring you. They're giving you all these words which mean nothing, I promise you. That was ordered, President, your prior. Okay, and I can see they put you on a monoclonal antibody. So listen, Cassandra, you call at oasisofhealing.com and talk to Andy or Maya, and let's get things moving. Okay, you guys, and I need to clone myself. Stem cells. Stem cells and repurposed drugs, what do I recommend? It really depends on the situation. If you have CFCs, I wouldn't do any stem cells until they're gone. Repurposed drugs, yeah. Doxycycline, mebendazole, ivermectin. Um, I don't advise the Lipitor or any of the statins. It really depends on your situation. And you don't really need all repurposed drugs, although there's some. But it's more than that. Remember, it's the mind, body, spirit. And I promise you, if you are thinking that you're just a body, like you're going to take your car into the garage and get it fixed, it doesn't work that way. Okay? We've got to also be dealing with all this other stuff. That's why our center is gonna have in Thailand gonna have everything. Here we will too as soon as we find a place to move. We've been in this place for 19 years and we've outgrown it. It's crazy, so we're trying to move. So here in Arizona, we're going to be big again and have everything. So because we need to have big centers because there's a lot of sick people out there. And listen. I don't say this at all out of arrogance, because there's so many sick people that I'm not here to sell myself, but I just can't find anybody that gets it and that understands what we are. And I don't know why, because I'm sure they know about me, and I'm certainly not quiet about it. I'm pretty clear about what we need to do, but no one's doing it. Everybody's doing one aspect of it. So I don't. I'm baffled. So my goal is to actually make, Oasis International, Oasis. It's going to be called Oasis Healing Asia, but I want to have so I want to have several there. But Europe, I had trouble. I tried to go to Europe. I tried to go to Netherlands. They couldn't. Not everyone will do that. In America, unless you're in Nevada or Arizona, you've got it's you're always defending yourself. But anyway, we're here, Arizona now. If you're sick, if you need help now, it's going to take too long to get me. When will you be in Phuket clinic? Oh, I'll be in Bangkok clinic first. We're building a Bangkok one first. That'll be late April, and then we build the Phuket one, and that'll be probably by about spring of the following year. Oh, anyway, you guys, I'm tired, and I talked to my team today because I want to get these different groups. I think it'll be so helpful, and it'll be almost like consultations. It'll be smaller. You can say things, and you just have to realize other people are going to hear. But here's the thing: the questions you have are probably the questions they have, because all that. But I want you to all remember something. You don't have a zodiac sign. You don't have a thing that's in you that's eating you. What you have is your body adapting, and your body's smart. And so your body. Imagine the trouble. Your body's trying. That's why the ferritin's high and the iron's low, because the body's saying, wait a minute, the CFCs have too many iron receptors, so I better grab it and keep it in the ferritin, so that because ferritin is storage. But then the iron goes low and you get anemic, and it's like, so the body's having a hard time dealing with this whole thing. And so we need to go in, and what we need to do is re-establish balance in every system: your central nervous system, autonomic nervous system. Your hormones need to be balanced, not blocked. We need to get your dental work done by the best, so there's no toxicity. We need to get the parasites out. We need to do juice cleansing. We need to do colonics and lymphatic therapies. We need to do movement, exercise, prayer, and meditation. Um, be outside, move, climb trees. All you got to do. You're not wanting to get rid of your CFCs. You're really wanting to be restored to health. Your goal is health. It would be no use to get rid of CFCs if you had stage 4 heart failure and you couldn't go to the bathroom without oxygen. You wouldn't be happy. Your goal is not just to get rid of CFCs, it's to be restored to health. Not to be restored, it's not passive. There's only one way to get healthy, and that's through healthy living. And but we need help because we grew up in this sick world. Okay, you guys, Sawadee Cup, Cup in my cup, and I'll see you next week at 5 o'clock, and I'll be on time. I promise.